The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. It is Monday, the 15th of September, 2025. We have a very important show for you today. We have Dr. Suzanne Humphries, and we're going to be talking about jaundice and the blue lights. This is something I knew nothing about. And so Dr. Suzanne Humphries has put a lot of work into this and is going to be explaining what this is about. Good morning, Dr. Suzanne.
Good morning, Polly. Good morning, everyone.
Well, this is an important subject, so I'm just going to let you get right on with it and explain why this is not what we thought it was, as always.
Right. Yes. So I first started looking into this back when I was studying the infant immune system and looking at the medical system's interventions and why things go wrong. So I started looking at it in 2014, put it to rest for a while. And Polly and I were just talking about it again recently. And she said, "Oh, why don't we talk about that on the show?" So I've made up a little PowerPoint and I have a few things to say. And, this is really the cliff notes, I'm telling you. But Lou will be putting up the PowerPoint slides, so you don't have to take screenshots or do anything like that. And also there are 3 articles that I had translated that will also be put up in the comments that you can have. So the first slide, basically introduction to infant jaundice, like why does it occur and what can we do? And a lot of this is geared towards people who are planning pregnancies or who may be pregnant now, because, if you've already had your baby, then this probably won't be of much use. Okay, so the next slide. We're told that 50 to 80% of newborns today will have some jaundice. And, that will also depend on if they were born prematurely or if they were born at term and what kind of interventions may have happened. And we'll get into that again in a short time. So the next slide is slide 3. What is jaundice? Just for people who may not know what it is, it just basically means yellow skin and eyes, which comes from the buildup of bilirubin. And that bilirubin comes from red blood cell breakdown and a delayed clearance by the liver. And there can be lots of causes of this throughout life, but what we're going to focus on today is infant jaundice. So let's go to the next slide, slide 4. And I just want you to know that this is not a comprehensive list of reasons, and there are many more, but they're not so common. So I'm just going to focus on the most common and the ones that I think are treated inappropriately and what we can do about it. So the first one is called physiologic jaundice, and the medical system will describe this as, the baby has a sluggish liver and it's not quite ramped up yet, and so it can't get rid of the bilirubin. So the issue with jaundice is that you can have production of bilirubin, or I should say release of bilirubin, and then you should have clearance. And if there's low release and there's rapid clearance, then you don't have jaundice. But if you have a lot of release and slow clearance, then you're going to have jaundice. So this is mostly something that the liver has to deal with. So physiologic is the one that we're going to be talking about the most. But then there's this thing called breast milk jaundice. And some women do report this. This will occur after 1 week after birth. It's not severe. It will resolve on its own, but it can take up to 3 months. And it's called breast milk jaundice because there seems to be some sort of chemical in the breast milk that kind of impairs bilirubin's conjugation in the liver. And conjugation is something that the liver does in order to be able to break it down and get rid of it. And so that can slow down bilirubin excretion. And it's very poorly understood, but it's not a problem. And then we have something called breastfeeding jaundice, but it really should be called lack of breastfeeding jaundice, because what this really is that the baby isn't feeding well at all, that the baby can become dehydrated and isn't eliminating those pigments through the intestines and the kidneys. And it should be known that babies are born with very small amount of water in their bodies, and we later gain more water throughout life, and into adulthood we have even more. But birth is essentially a normal dehydration status that should be rapidly remedied by the mother's milk. Okay, so the next slide. this is basically my disclaimer, okay? Even though I don't always agree with it, I have to say this. But certainly if jaundice is severe and it's on the first day of life, that needs to be looked at. This is not a child that you're just going to stick out in the sunlight. This is some child who you're going to want to look at underlying causes of why they could be breaking down red blood cells. They might have an Rh factor incompatibility. They may have been born with a genetic abnormality, and that needs to be looked at. We can't treat that lightly. The other instance is that, maybe the baby wasn't born with jaundice, but it's severe and it's worsening rapidly in the subsequent days after birth. Those are babies that probably should have some measurements done. And what I want to say to you is that medical interventions can actually prevent severe problems, but they can also help or hinder overall health in the long run. And the one thing we're looking out for, and this is really the reason we're treating jaundice, is that babies can wind up with severe and irreversible brain damage if the jaundice is severe. It's called kernicterus, and it basically gets into certain parts, I think it's the basal ganglia of the brain, and can cause severe problems later, mental retardation. So you really don't want this to happen. So we're not taking lightly the severe cases of jaundice. We really know that that does need to be treated, although I don't agree completely with how the conventional medical system treats it, and I'll address that towards the end of this talk. All right, so the next slide, I'm just putting this up here, and you can find this graph in lots of different places. So the risk assessment, and this is conventional risk assessment here, is based on how severe the jaundice is and when it occurs. And this is just a simple graph showing you what they consider to be high risk, intermediate risk, or low intermediate risk. All right, so next slide, slide 7. I want to talk about some trends. And, I suspect that that in ancient times there would be very rare jaundice, and supposedly there are some evidences of ancient Egypt babies being treated under sunlight in the hieroglyphics. I can't verify that. But infant jaundice, it was not reported to be common in medical texts before the 1900s. And so that's really what we have to look at. What does the medical literature say? And yeah, we can look at hieroglyphics and, other places, history books. And I didn't do a deep dive on this. But what I can tell you is that since 1990, that infant jaundice, neonatal jaundice, is on the rise globally. And you can see the reference there. But mortality has declined. And that's to say that, medical interventions can help in terms of these really severe cases. And even the blue light, which is toxic, can prevent a baby from having severe brain damage in the long run. But again, what is the cost of the treatment? And that's really what I want to focus on today. So before 1990, there were problems, when they were using what's called twilight anesthesia and forceps births. And those were known to be associated with more jaundice. There would have been more bruising on the baby. There would have been more chemicals that were being brought into the baby, and maybe some impairment of the liver on that basis. Yet the overall numbers of physiologic jaundice were relatively low. And it really seems to have gone up. There's definitely a trend of it going up since the 1990s. And I sit back and I think, well, what's changed since the 1990s? Well, pretty much a lot has changed since the 1990s. When I was in medical school, I don't even think I had a cell phone. I think we had pagers, and then during residency, like those big clunky cell phones became more readily available. And then there were more cell towers, and then there were the LED lights and more computers. There's been a lot of technology since the 1990s. And we also have to consider that there have been additional medical insults to both the mother and the infant since that time. And even, I would say, from the mid-1900s onwards, more medical insults to the mother and the infant. And I think that probably has the biggest impact on what the medical system considers physiologic jaundice, which I don't consider physiologic jaundice. I consider that it's mostly iatrogenic, meaning it's probably largely caused by the medical system, as well as habits and lifestyle choices that the parents make. and that those weren't available in the past. Okay, so next slide, I want to talk about treatment. And I just talked about ancient Egypt. We know that they worship the sun. So of course they would have, put the baby out in the sun. And these people would have been very dark skinned. So they could have left babies in the sun for a longer time than people with light skin can do. And so that's something we'll talk about in a minute. If you go looking around the internet or into history books, you'll hear about this nurse that was working in Essex in the United Kingdom in the 1950s, and she was working in the premature ward, and she happened to have taken this baby out into the sunlight, and the baby was just partially covered. And when she brought the baby back inside, they noticed that where the covering left off, the jaundice persisted, but where the covering was off of the baby, like the face and the hands, that the yellow color went away. And then somebody left a test tube in the windowsill, a blood test tube in the windowsill. And when it was tested for bilirubin, it was really low. And then they retested the baby that it came from, and it was really high. So they realized that sunlight probably had something to do with lowering that bilirubin level. So in the 1950s, and probably before, although I can't really speak in depth about this, that sunlight or even full spectrum light started to be used at that point in the 1950s. And then after that point, there was a study that came out that was probably pretty flawed. They reported eye problems with full spectrum light. And the problem is that they were correlating full spectrum light to the sun. And the sun always has red light that helps to neutralize ultraviolet rays. So that's the basis of us switching over to blue lights. And that's now become the standard of care. And I think that there are some major problems with that. There's some very well-known toxicities associated with this type of light. It's very stressful to the baby. If you talk to somebody who's had to do this for any period of time, the mother's stressed out, the baby's stressed out. It's not very nice at all. All right, so let's go to the next slide. So bilirubin, interestingly, so this is what I do. Whenever I see that the body does something, I go and I look it up and I say, is there possibly something good happening by this body's response? And indeed, bilirubin is known to be an antioxidant, actually, and it has the capacity to dampen down oxidative stress. So getting rid of bilirubin using blue light, it may be effective because it breaks down the pigment, and in severe cases, it can help that baby not have brain damage from the bilirubin. But for everyone else, we really need to thoughtfully reconsider using blue light as the treatment for infant jaundice. And, if you can look at any, next slide is slide 10. So any AI search engine will tell you that bilirubin is an antioxidant. I didn't make that up. You can find it all over the place. And the bilirubin is trying to do something. It's the body's response to stress. So the stresses are variable, and we'll get into that in a second. So the next slide, slide 11. We're going to talk about the oxidative stress, and you'll hear terms like redox, oxidation, reduction, and this has to do with what we call free radicals. And what free radicals essentially are unpaired electrons that can cause damage to phospholipids, to cell membranes, to proteins, to DNA. And I talk about this a lot in my vitamin C lectures, which you can find on my Odyssey channel. So it just so happens that red blood cells are very susceptible to lipid peroxidation because they have a lot of unsaturated membrane lipids. They have a rich supply of oxygen, which actually can cause oxidative stress. And they have transitional metal catalysts. So there's iron involved, there's catalase involved, and there's a lot of chemistry that I'm not going to get into. But also giving unnecessary oxygen to a newborn baby can add to the oxidative insult with the blue light together. Can be very problematic. So it is true that neonates do have a lower capacity to deal with oxidative stress than adults, and that's more so in preterm babies, and that's probably why we see more of the jaundice in preterm babies, but there are also other reasons why we see more jaundice in those babies. So let's go to the next slide. This is slide 12. And this is just a very incomplete list of what can cause oxidative stress to a baby. Basically anything that can, knock those electrons loose. And anything that's poisonous, anything that causes inflammation, or anything that causes stress, even emotional stress, can be oxidative. It is oxidative, very well known to be. So the list that I have here includes giving vaccines to the mother. We know that causes inflammation in the mother. We know it causes inflammation to the fetus, and we know that it changes the fetus's immune system. And I get into that in my infant immunity talk, again, which you can find on Odyssey. Infections to the mother can also have downstream effects onto the fetus, and this is what the pro-vaccine will bang on about and tell you why every mother needs to be vaccinated. So we're going to give them all inflammation instead of just letting the ones have their, flu viruses and deal with it normally, which most of the time the baby doesn't have an effect from. So if we have a very rough or stressful or a chemically mediated birth, which is very common and becoming more common, especially into the 1950s onward, then we can certainly have a lot of inflammation in the newborn. The hepatitis B vaccine that's given to the newborn, absolutely contributing to this problem as far as I'm concerned. The vitamin K injection to the newborn, Polly will tell you on the bus, she heard over and over and over again. And vitamin K injection contains aluminum. And even though it's not technically a vaccine, it is inflammatory. And in my opinion, it's unnecessary. Drugs that are given to the baby or drugs that go into the baby from the mother, when the mother is given drugs during birth or even before birth, have the capacity to clog up the liver and cause inflammation. And then we have the immediate cord clamping bad habit that only humans do. And that can lead to a situation where you don't have the ability to dampen down the inflammation that may have occurred because all those anti-inflammatory chemicals that are coming from the mother, as well as the stem cells that are there to basically do the cleanup job, it's estimated that between 30 to 40% of them will be left behind in the placenta. And then we have an issue that I'm, basically recently started learning about, which is the blue light for the baby for the just in case situation. So we have the just in case, oh, your baby's a little bit yellow. Let's just put them under the blue light. I think this is fortunately trending down, but I'm still hearing stories where unnecessary blue light is being used on infants with mild to moderate jaundice. And then we've got to think about blue light to the mother. So where does blue light come from? Well, it comes from all these tablets that we're looking at. It comes from your television. Any of these screens that we're looking at can be giving a lot of blue light into the eye, and that can have some downstream effects inside the body. And then you have something called non-native EMF, and that's a whole other area to go into, but that can have mitochondrial quantum consequences, how light is dealt with in the mitochondria, how the electron transport chain, which is really important in terms of energy production, is dealt with. So non-native EMF is all, the cell towers, it's your Wi-Fi in your house, it's your electricity, the dirty electricity in the power points in your house and things like that. All right, so let's go to the next slide, slide 13. I think that there's a lot of good examples in real life as well as literature showing that we can prevent a lot of this jaundice. And this is a very incomplete list because there's probably hundreds of ways to cause maternal and fetal stress. But the most important ones, I think, are listed here. And we're going to start with the optimize, that's what, okay, when the mother is pregnant, it would be great if she can optimize what's called her redox status. And so we have the ability to generate those unpaired electrons and the ability to give back electrons and dampen it down. So it's called oxidation and reduction. And some of the things we can do for that is get on a circadian rhythm. This has to do with our wake and sleep cycles being correlated to sunlight and darkness. And ideally, we weren't born on this planet with clothes. We weren't born on this planet indoors. And we've moved more and more indoors over time with more blue light. And so getting outside more, having real sunlight, not to burn yourself to a crisp, especially if you have a lot of oxidative stress. You first want to deal with your own oxidation status and then start slowly building a solar callus and thoughtfully. I don't mean going out and putting baby oil on your skin and frying yourself. Obviously, eat real food, but the healthy oils and proteins are really important for a woman that's creating a baby. And look, all stress should be avoided when a mother is pregnant. That's the ideal, and especially unnecessary medical threats. And the unnecessary medical threats are too numerous to list on this slide. So I've already talked about the blue light, the phones, the TV, the LED. These should be limited. Ideally, pregnant mothers shouldn't even be looking at blue light cell phones. And there are alternatives. There's something called the light. I think it's called the Light Book. I actually have one, and it's basically a black and white tablet that doesn't have any red light whatsoever. So I can be reading that at night. I can be reading it whenever I want. It's not going to interrupt my sleep. It's not going to cause me to have type 2 diabetes, which I was actually starting to get myself from my own blue light abuse. I was completely unaware of. Anyway, that's another story for another day. These LED lights, the ones that blind you on the street at night when the cars are going by, well, they're also in your house. And so those things are really not ideal. Much better to have incandescent lights, but even better to just have no lights. Just go to bed when the sun goes down, unless you're living in a northern or far southern area where the light goes down earlier. I don't know why, but I can't get people to stop using their Wi-Fi at home. You turn off your lights at night, you turn off so many things at night, but you don't turn off your Wi-Fi. And at the very least, it should be turned off when you're sleeping. But ideally, I don't live with Wi-Fi. I don't like it. And I use Ethernet cables. And I think that that's better for everybody. So anyway, sunlight when the mother's pregnant, all over her body in appropriate doses, on her belly especially, not burning. Again, late morning, late afternoon sun, or even early morning if you're a really light-skinned person. So this is all very skin type dependent. And look, we've all known how we burn and when we burn. There are different skin types, and different skin types need to develop a solar callus differently and do it safely. And whenever it's possible to just get away from these densely populated 5G cities, they're not doing your baby any good whatsoever. All right, so slide 14. Let's look at some of the studies. Okay, so we've got, we're going to start with this antioxidant here. And I'm just going to say that the problem is deeper than just some missing antioxidants. So the problem with jaundice, it's not just about missing antioxidants, but antioxidant status can be very low in these babies, and the bilirubin is trying to do something. But sometimes, even though antioxidants aren't the actual cause, giving them can intervene and can help with the problem of jaundice. All right, so the next few slides, we're just going to look at a few studies that examine this. So we're on slide 15 now. And before I go on to the studies, I just want to say that you can look a lot deeper into the cellular and mitochondrial quantum physics if you want to. And this is where the effects of blue light take place. So what I'm going to do, instead of getting into that myself, is refer you to Dr. Jack Cruz, who can explain these intricacies. And he's got blogs on Patreon. He's got lots of info on his X page. And this is just one post that I think it has 11 parts, and it's really interesting. And it's got a lot of good information. And he suggests that there's something called mitochondrial heteroplasmy, which basically means that there's mutated DNA and normal DNA within the same cell. And that's really not ideal. We should have none of that. But babies are born with a little bit of it, and we get more of it with each decade of life. And nowadays, babies are born with more of it than they used to be. And that's because of all the things I've just been talking about. So this can also contribute to the jaundice, and he has a ton of information about how modern lifestyles and changes in light affects the eyes, with downstream effects into the nervous system, and have fallout into the glandular systems, which can wreak havoc through the body. And I found that to be true for my own self. I can only imagine what it would be like if I was trying to grow a baby inside of me with having all this blue light and all this EMF. So I've cut it all out of my life. Anyway, and so the light and the EMF insults to both parents actually can have negative effects on the offspring. So you can read more about that there. All right, so the next slide is slide 16, and I'm just going to start with this one, Abdul Razak from 2007. And so this was a study where they looked at babies who had enzyme deficiencies. So they had really severe problems. And they also looked at babies that didn't have high bilirubin, and they looked at some that did have high bilirubin. And they just observed that the ones that didn't have super high bilirubin had higher levels of vitamin C than the ones that did have high bilirubin. The same went for vitamin E. So the antioxidant status in neonates with hyperbilirubinemia was very low. All right, so let's go to the next slide. That's slide 17. This is by Garbelli. This was done in 1957. And this I had translated by some generous person who did the translation from Italian for me. And that article is available. And it's really interesting that, there probably are some English language articles about this, but the best ones I found have been in Portuguese and Italian. And so I've had them translated for you. But this one is really interesting. It was from 1957. So it's an older look at infants with jaundice from a much simpler time on Earth. And what we saw is that they had 89 pregnant women during the first trimester of pregnancy, and they gave 1 gram of vitamin C by mouth every other day for 6 weeks. And what they found is there was no jaundice in 61% of those babies when they were born. And the quote at the end from Garbelli says, the physiologic jaundice of the newborn, which is reported in 80 to 85% of cases and was therefore observed a more or less degree only 27.5% after the vitamin C was given. So even in 1957, they were seeing a pretty high amount of jaundice. Well, again, what were they doing? They were starting to use anesthesia on women. They were starting to use forceps. God only knows what else they were doing. So that's from 1957, but we're not going to stop there. The next slide, slide 18, shows an article by Al-Hosseini. And this doctor, you basically did the same thing. And I'm trying to remember when this was published. It's more recent. I can't see it on my slide, though, but it's much more recent. And it showed the effect of vitamin C supplementation in the last month of pregnancy on looking at neonatal bilirubin levels. And they found the same thing. And they used 500 milligrams per day instead of 1,000 milligrams every other day, like the other study did. And they showed a far lower jaundice level in those whose mothers were supplemented. Okay, next slide. This is slide 19. So why am I banging on about blue light? What kind of problems can it cause to the infant? Well, okay, so we first need to understand that this is not an easy thing to study in humans over long time frames because so much happens to a person after they're born. And so to have control groups, et cetera, can be really difficult. So a lot of the research that exists has been done on animals, and it's been done in cultured cells, but some of it's actually been done in humans. And so this is a list of some of the reported outcomes, which include growth plate damage, which is observed in rats, mutagenic, which means DNA mutations, or gametocidal, meaning germ cells can be damaged, has been found in rats. It can alter circadian genes. That's really important. There's something called the syndrome of inappropriate antidiuretic hormone, which can be a problem in water handling through the kidney, something I'm very well familiar with, and that can be exacerbated by blue light. Myeloid leukemia, and I think there is some literature about this in childhood. There's a definite change in cytokine production after blue lights. There can be negative cardiorespiratory influences. There could be changes to the blood flow and changes in kidney function, DNA damage, and eye damage. I mean, why do they have the baby have an eye cover on when they're under the blue light? Because they know this, right? All right, next slide is slide 20. Okay, so this is a study that was written in, the abstract is in English, but the study was in Portuguese, and I used Google Translate and meticulously had it translated for you. And this is done in 2007, and it's called Total Oxidant Status in Jaundice Newborns Before and After Phototherapy. So phototherapy is the blue light they call therapy. And anyway, what they did is they looked at 34 full-term infants and they looked at their antioxidant status before and after. And what they found is that there's a definite tendency to cause oxidative stress in these jaundiced infants by giving them blue light. The next slide is also it's the same author, and this is one of the charts from that study. Now, I left the chart in Portuguese because it's a lot easier to understand than when I translated it to English, it became very messy. But we can still see the important parts here. Is that what we can see is that, so antes means before and apos means after in Portuguese. And so if you look at the top, you see the two columns, and then you see the differences before and after. And so if you go to vitamina C, which is the fourth line down, you can see that the vitamin C level dropped after phototherapy, so from an average of 2.1 to 1.3. We can look at the uric acid level. Acido urico went from 5.0 to 3.7. And you might think, oh, doesn't that cause gout? Well, yes, it does if it's in a joint. But again, uric acid is trying to dampen down inflammation. You can put it into an AI search engine. You'll be told that uric acid is an anti-inflammatory when it's circulating in the blood. And so again, the uric acid is trying to do a job here, and it gets damaged by the blue light. We see that hydrogen peroxide rises. So that's the one that says H2O2 per liter. It's the equivalent of H2O2 per liter. It's actually called EOT, which is the total oxidant status. And so that went from 11 up to 16. So we had a rise in oxidants, a rise in oxidative stress from looking at that. And a lipid peroxidation, so that's the hydroperoxido lipidico, where you can see down there from 6 to 7.3. And IEO is oxidative stress index. That's the very last line, 0.07 went up to 0.11. So these are direct measurements. And the quote from ACEC is, the conclusion is that phototherapy has a negative effect on several parts of the oxidant-antioxidant system in newborns with hyperbilirubinemia, exposing them to possible oxidative stress. Well, he's being very polite there by saying possible oxidative stress. So the next slide, slide 22, is by Augusto Sola. It was a commentary to the previous article. And the commentary is titled, Turn Off the Lights and the Oxygen When Not Needed, Phototherapy and Oxidative Stress in the Neonate. I'm going to talk about this a little bit more. I've also translated this for you, and that will also be in the comment section. So let's just go to slide 23. And I put this up just in case somebody wants to say that I'm quoting a quack that doesn't have any experience. This is Dr. Sola's resume. He's an honored professor of pediatrics, of neonatology, and neurology. So I think he's pretty qualified and experienced to speak on the subject. The next slide, slide 24, Dr. Sola concludes by saying, and he has a lot of things to say. In fact, this is my favorite commentary if you just read the Sola article, which I'm not going to get into in depth, but he's pretty much on fire about this and really feels that the blue lights are overused and that giving oxygen to these newborn babies is another insult if they really don't need it because of the oxidative stress. And he says something that the pro-vaccines say to us all the time, which is absence of evidence is not evidence of absence. But in this case, it's actually true because there's not been a lot of study into this. But the studies that we do have, I believe, shows that there is significant oxidative stress by blue light. And he says the more we study, the more we become aware of our own ignorance. And man, oh man, have I found this to be true in my 61 years of life. So I hope everybody finds this because I think this is really how we gain wisdom, is how we understand what our own ignorance is. And he concludes by saying that it's surprising how little is known about the damage caused by phototherapy and its probable mechanisms. Anyway, that article will be there for you to read. I'm not going to spend a lot of time on. These are all very short articles, by the way. They're between 2 and 3 pages. Okay, the next slide, slide 25, from Dahia in 2006, again, showing us that phototherapy increases oxidative stress. And this article is available for free online. And it's an Iranian study which looked at the antioxidant status before and after blue light. And let's go to the next slide. This is the abstract, slide 26. And you can go ahead and read that for yourself if you want. And in the next slide, slide 27, I'm just summarizing. And now I'm just going to say that the length of blue light therapy in this study was up to 72 hours. So that's a bit more aggressive than the average infant would receive, 48 hours, unless there's severe jaundice. But the results still show that there's a rise in oxidant markers and a fall in antioxidant activity. Okay, so this is just the take home here, is that look at the reduced glutathione. So you want glutathione to be reduced, meaning that it's able to dampen down oxidative stress. So these infants started out at 29 and landed up at 14. The vitamin C levels were pretty much cut in half after the blue light therapy. Yeah. Okay, so let's go to the next slide. Okay, so we're wrapping up here. And so these are just kind of my take-home messages for newborn jaundice. And look, I've outlined above how the problem can be avoided. Most people are going to ignore me because they're addicted to their tablets and they're addicted to their computers. And man, I mean, we got to break this. This is such a problem. I think we need to just start checking into our phones twice a day and doing things like that, because it is literally taking over our brains. And anyone listening to here knows exactly what I'm talking about. We need to get out of the habit of taking our phones everywhere with us and looking at them every 2 minutes. I grew up in a time where we didn't have these things. And I think probably a lot of people who are, I should say women who are pregnant right now, didn't. They don't even know life without cell phones. But think about it. So avoid the problem. Don't use blue light treatment if it's not necessary. Don't give oxygen to a baby if it's not required. If bilirubin is mildly elevated, then give vitamin C, sunlight, and give that mother's milk to the baby. Give the mother vitamin C and sunlight and avoid that blue light. If bilirubin is moderately elevated, make sure it's not rising rapidly. Give the vitamin C, the sunlight, and the mother's milk. Same thing for the mother. If bilirubin is greater than 15, then yeah, we do have to evaluate this more closely and make sure that it's not rising. And again, do as above. If it's greater than 20, then there's some concern, because if it hits 25, that's when the kernicterus problem and brain damage can occur, because the infant brain is non-myelinated, and so and the blood-brain barrier is not tight at this point, and so that's why the bilirubin is really able to get into the brain, especially if it's at high concentrations. So this is something that you're going to have to unfortunately be in the hospital dealing with. But now, at least if you know all of the things that I'm telling you, you can be more knowledgeable. And next slide, slide 29. I always check in with people who do this on a regular basis. And I like to check in with people who have a whole lot of experience. And so I have a really good friend who's a highly experienced midwife. For 34 years, she's been a midwife. And she's also an acupuncturist, and she thinks holistically and has been boots on the ground for a long, long time. And these were her exact comments to me. I'm just going to read them through for you. She says, we shouldn't be taking bloods for SBR testing based on color alone, although this is a common practice. We all understand that this is a normal neonatal transition from life in utero to life on the outside. We should be assessing the baby holistically. Is the baby waking for feeds and has good tone, or sleepy and floppy? Are we having frequent enough feeds? So a floppy baby, and a baby that's not waking up to feed, yeah, this is a problem. You've got to do something. Some of them may even need a tube placed, and the mother might need to pump milk to get that into that baby. Yeah, and so this whole thing about being a normal transition from life in utero to life on the outside, I think that's also debatable, because Polly can back me up on this, but I've got a lot of friends and acquaintances that do everything holistically in having their babies. When I ask them, did your baby have jaundice? I'd say it's universal that they say, no, my baby didn't have any jaundice at all. So a healthy mother who is who's eating well and who has a non-stressful gestation and a normal birth, and doesn't give vitamin K or vaccines to that newborn is far less likely to have a jaundice baby. It's just a fact, and we see it all the time. And I think the commenters will know this is true as well. Yes, of course, there would be an exception always. And yes, the blue light, even in those situations, can be a problem. Okay, next thing she said is, while the baby is processing this bilirubin, then it's a good idea to have them feeding 3 hourly. Monitor their output. That means their urine output. If they're having plenty of wet diapers and the occasional dirty diapers in the first week, then they are processing it. Expect that you might see yellow whites in the eyes as well as urates in the diapers. I actually can't tell you what urates in the diapers look like. Maybe somebody in the comment section can. I didn't have time to look that up. This is normal and part of the excretion process. She says to encourage nutritional support for the mother and exposure to sunlight during the day for both mother and baby. And again, I can't stress enough that be wise about your skin type and your skin color. You don't want to leave your baby baking in the sun for an hour. 10 minutes is probably good to start with, 10 minutes a couple times a day, and see how that goes. Increase if you need to, but you don't want to burn the baby. So following birth, give additional vitamin C. Her recommendation is to give 2,500 milligrams twice a day to the mother to help aid in her recovery. And yes, some of that vitamin C will be passed into the baby through breast milk. It's not a whole lot. I've looked into this in the past, but some of it will be. And she says, in all my years of practice, 34 years, I've only had I think she meant handful of the breastfeeding jaundice hang out beyond the time of discharge from my care, which is 6 weeks. Most babies will have cleared it within 2 to 3 weeks. Okay, next slide. I just decided to go on because I was sitting there and I was thinking, well, okay, we should definitely be giving antioxidants to the mother, in addition to everything else I mentioned with the blue light, et cetera, the nutrition, the sunlight. Not that the antioxidant status, or I should say the lack of antioxidants isn't necessarily the cause of the problem, but we can intervene and we can make a difference, as I showed you with those Italian studies. When I ask if the AAP recommends vitamin C for infant hyperbilirubinemia, it says that no, it doesn't, because studies are inconclusive and because blue light is so effective. I'm just summarizing that for you. Okay, so this is today's recommendation. Slide 31. Again, I asked, does the AAP recommend any antioxidants for infant hyperbilirubinemia? And we're told the AAP does not recommend antioxidants, again, because blue light phototherapy and exchange transfusions are used instead. You don't even want to know about exchange transfusion. And then the very last slide, I was thinking, well, why aren't we just treating babies? Why haven't they not figured out how to just give a little bit of vitamin C to the baby or a little bit of glutathione to the baby if they have severe jaundice? Why is it always just blue light, blue light, blue light? And the AI search engine admits that there are studies investigating antioxidants like vitamin C and E for infant jaundice, but that they show mixed results. And according to the mainstream norm, actually, that they need to be investigated further. And they say that they're still under investigation. Well, what are they waiting for? I think we've got enough information, and we know that vitamin C and glutathione are far less problematic to give to a newborn than blue light, which we know is toxic and probably the wrong way to go about it. Ideally, I think we would have sunlight rooftops, and people would be able to go up there and in a controlled condition get full spectrum sunlight under proper conditions, just like they did back in the days of tuberculosis. We need to get those rooftop decks put back onto hospitals. And I think that's it for me. So.
Well, that was fascinating. Thank you for your work on that. But now I particularly like Lisa's comment. I'll tell you why. So she's written, as a postpartum doula, I am seeing an alarming increase of babies being classified as jaundice and needing to return to the NICU, which is then billed to insurance at the tune of $10,000 a day. So this reminds me of the work we did on Vax 3. Everyone survived COVID out of the hospital. You went into hospital, big money to be made. And we are also seeing the home births not getting jaundice, well, the ones we've spoken to anyway. So my question is, there's no doubt to me that I'm sure they're making a lot of money out of this. If you're a young mother and you've just given birth and then they suddenly tell you that your baby is dangerously jaundice, all that talk they do to get their money and get that baby under a blue light. What do you do if you've got no medical training other than trust the parent? Because we don't want this blue light. How do we navigate that? And that's a very hard question.
Yeah, I'm not really in a position to guide mothers in that situation. However, I think you'd want to look at that chart that I put up early on and what the risks actually are in terms of days after birth and what the level is. I would assume if jaundice looks severe in a baby, that you'd want to get a blood level. You'd want to have some sort of answer from that in terms of what the level is. And if it's not what's considered to be life-threatening, then you do have time to try the sunlight and the antioxidants. And you'd have to work with your midwife or your GP or whoever. I'm just going to say that I've treated whooping cough in newborns. I've treated whooping cough because you can get whooping cough at 2 weeks of age because you can catch it in the hospital when you're born. And we've given massive amounts of vitamin C to these 2-week-old babies, and they do perfectly fine with it. I'm not suggesting to give massive amounts of vitamin C to a neonate, but you can give a small amount of vitamin C to a neonate. And I just don't understand why that's not done in hospitals. And I've done lots of talks on this. We've seen the measles deaths. We talked about that the lack of vitamin C in the diet, and then all the drugs that are given that consume vitamin C hand over fist. And these kids basically end up with scurvy levels of vitamin C in their bodies. And I just don't see why this is not addressed. And, you just answered, that midwife answered a question that I had in my mind, like, what's up? How are they making money on this blue light? Well, now we know it's billable. Of course. Why didn't I think of that? So all the things that aren't billable, I think they could bill. I think people would be happy to pay for antioxidants being given to their newborn. Why not do both? And then the treatment, the blue light therapy would have to be less of a time and less of an intensity.
And then we've got the home birth situation again. The fear of having a home birth. I was talking to one of my mother's friends when I was back in England, who was freaking out that her daughter wanted a home birth, saying the baby could die, you're not near any hospital. But we know from speaking to the people that more things go wrong in hospital than they do at a home birth. So a home birth, you're much less likely to get this baby whizzed off for 10 grand a day. Jaundice
Yeah,
thing.
not just home birth, but a midwife birth. And I think I've got a study that looked at the difference in interventions, drugs, et cetera, in midwife births versus doctor births, no matter where they are. And it's far lower in midwife births. So so the average, I shouldn't say, because nowadays some of the midwives are really no better than the obstetricians, but a lot of them are. And so if you have a midwife that has a better ethos, probably they're the older midwives, to be quite honest with you, then you want to go with that. But yeah, home birth, so many people are doing it. And I think, join a group, a home birth, mothers group. If it's your first baby, I think it can be a little bit intimidating. Maybe a birthing center that's run by midwives with obstetrics backup. But usually after mothers have a baby or two, they get really confident and they're perfectly happy to have their babies at home. Yeah.
Just a little midwife story. I was born at home and I did stop breathing back in the day. And the Jamaican midwife gave black tea to me. That was my first thing. And back I came to life.
They gave you what?
Black tea. That was the first thing.
Well, what they do in the NICU is the caffeine resuscitation after the hepatitis B vaccine. So caffeine's been long known to help in resuscitating infants, and you were one of the early trials.
Yeah, but it brought me back to life. So what I'm saying is things can go wrong, but with an experienced midwife, Dr. Suzanne is absolutely right. I've witnessed home births myself, and they're just amazing. Okay, now so when we were on the bus, the vitamin K and jaundice thing came up. It was just the weirdest thing. And we were just finding that the unvaccinated kids that did not have vitamin K did not get jaundice, and the ones that did. So Adriana is asking if there's any link between vitamin K and jaundice, and someone else is asking, is there a way to detox from vitamin K? And you may not be able to give that advice out, but those are the questions coming in about vitamin K.
Right. Well, so basically babies are born dehydrated, and they're born with blood that's thinner and has less, the coagulation factors than maybe when they're 8 days old. And I believe that's by design. So if you're dehydrated, even as an adult, you want your blood flow to be better than if you're not dehydrated. And so until that baby starts drinking and becoming better hydrated, and again, this is by design, you want the baby to fit through the birth canal. And so that's why it leaves 1/3 to 1/4 of its blood supply behind in the placenta, so it can get out the escape route and then bring its baggage with it afterwards. And so it is a dehydrated situation, relatively, I should say. Sorry, I was looking at the time remaining. Don't
worry about the time remaining.
Okay. Yeah. So in that situation, you want to have thin blood when a baby's born. Now, if you had an excessively traumatic birth, then yeah, that baby is at risk for having some brain hemorrhages and brain problems. I mean, even later on, if, say the mother's nutritional status wasn't adequate. But okay, so you have this situation of slowing the blood down if you give that vitamin K injection, and that's essentially you're thickening up the blood by increasing coagulation factors that aren't naturally there. And personally, I just always trust nature more than I trust the medical system intervening. And I think that it makes a lot of sense to have blood that's thinner and less able to coagulate and clot right after birth, so that the stem cells that are coming through are able to go in and clean up some of the damage. So I don't think it's a good idea. I think the mother can be eating more vitamin K during gestation. A lot of that is not transferred to the baby because by design, the baby doesn't have a lot of vitamin K cofactors when it's born. So do you trust nature, or are you going to trust medical interventions? Well, if you feel like it was a traumatic birth, or there's bruising, or you think, the baby's brain got a lot of, unnecessary trauma, you could just do a lot of parents do is the oral vitamin K drops after birth. In that situation. But the medical recommendations are that it has to be given straight away. And if it's not given straight away, that you won't get the benefits. I don't know. I just find a lot of problems with the reasoning. I haven't really done a deep dive into whether somebody's looked at jaundice before and after vitamin K. I suspect that's a do not cross area, but maybe there's some research, probably in other languages, because, I find with everything I've studied, we live in this big world with so many languages, and I studied ozone for a really long time, and the best ozone literature is in Russian, so that's kind of some of the problem is the world's literature isn't all translated into English. But yeah, I'd like to do a look into that to see if somebody's looked at jaundice with and without vitamin K. But when you know what vitamin K does, sluggish, it slows down the blood. So of course you're going to have less blood flow through the liver and less excretion of the bile that the baby can excrete through the function of the liver that it does have, which is not no function. The baby still has some liver function. That's a really bad idea. And that it has aluminum, which we know is inflammatory. It's highly inflammatory. Again, I did a talk called Trojan Horses and Cluster Bombs, available on Odyssey, which talks all about the aluminum and why it's such a bad idea to give to a pregnant woman or to a baby.
Let's talk about dissolving illusions quickly, and then we'll go to one more question. So it's a really important book, everybody. Suzanne, tell everyone where you can get it. People that watch this program don't particularly like Amazon, but it is there, isn't it?
Oh, yeah, but now we have our own bookstore. So if you go to dissolvingillusions.com, we're now using PayHip, and that's our store. So if you don't want to use Amazon, you no longer have to. We're translated into, I think, 9 languages now. We just got translated into simplified Chinese, which I thought was really exciting. So go ahead and check out all the translations, and everything you need to find is on dissolvingillusions.com. And so basically, I consider myself a bit of a medical historian, and that's really the work that Roman and I have done together. Is we've looked at the history of death in areas throughout the world where the statistics were available. And we found that the death rates had gone down significantly before the vaccines were brought into humanity. And so why is that? Well, because there were other interventions in the big cities that were overcrowded and really filthy that made more of a difference in the death rates for the major infectious diseases that are vaccinated for in childhood. And the bottom line is that none of them probably were ever necessary, that there was a lot of skullduggery and manipulation of facts to convince the public that, say, the polio vaccine got rid of polio, et cetera. We discuss all of this in depth in Dissolving Illusions.
And you can get a signed copy of Dissolving Illusions if you come to the conference. You're going to be signing those books there. And my favorite, Rising from the Dead. I love Rising from the Dead.
Yeah, that's my autobiography. And again, there's a link to that on the dissolvingillusions.com page, or right now I only have it on Amazon, but I think PayHip is actually selling it as well right now. And yeah, I will be at the CHD conference, and I'll be talking on Saturday. I really look forward to seeing you all. And I have a pretty good talk to give you on history.
Does epic talk. But what you could do is buy your Dissolving Illusion books, then go to Dr. Suzanne Humphries, got a booth, and get your book signed. Great Christmas presents, and especially for those slightly difficult family members, they've got to read this book. And it's on audio as well, isn't it?
Yeah, we have an audio and we have an ebook. And I will be having hard copies of the book at the conference. If you don't get one in time, I can give you one at that point.
Okay, I know we don't have much time here. We're going to do about how to follow you as well. But Renee do you know anything about the new mRNA pet vaccine? It's going to be self-replicating. And a lot of people say your dogs have to have the rabies vaccine. Well, I'm sorry, guys, but you can get out of that. Just don't. I don't know how you do it, but just take them away from wherever. What are they going to do? Tag your dog? I mean, when they say you have to have it, what, they're going to stop you in the park and say, give me your vaccine records? Do not give them the new mRNA pet rabies vaccine. It is a death sentence. I will just say that. Not necessarily views of Children's Health Defence or Dr. Suzanne Humphries. 100% the views of Polly Tommy. Do not vaccinate your pets, ever.
I love doing Q&As with Polly because she's like my alter ego. She says all the things that I can't say.
I can see by your face when you do this. We've been on the floor together. I'll do it then. But honestly, these animals, especially these, I don't know, these dogs, they live so much longer when they don't have a shot. Anyway, there's that. Renee, great question, great comment there. Jessica's well, but we've run out of time. We'll get her back at some point. I don't know when, but we will. But if you want to see Dr. Suzanne, do come to our conference because it's going to be really fun for us all to get together as well. How do they follow you? drsuzanne.net?
Yeah, that's my website. That's kind of under construction right now. Yeah, there's really no great way to follow me because I'm actually trying to have a life aside from when I come on to do things like this with Polly. But dissolvingillusions.com has a lot of information. I think I just send everybody there now.
Yeah, but you're really outspoken on X. You get involved in all kinds of things. It's really
I forgot about X. Yeah. So that's DRSUZANNEH7 on X. I do all my posting on X if you do want to follow me there. Thanks.
He really does get involved in a lot of stuff. It's quite fun. If you're feeling bored, then follow Dr. Suzanne. All right. Well, look, thank you for all that really hard work. To the people watching, and as Suzanne said, if you've had your babies, please do send them on to these young mums. It's so important. You know what? I just want to say one thing. If I go back and look at how I gave birth, which I did everything you should not do, it's really awful how we were so deceived with everything, just everything. Back in the day. I think we should make a movie, Suzanne, on what to do, the right way to give birth and all those kind of things for these poor young mums.
Great idea.
All right, well, let's get these other two done first and then we'll move on to that. All right, listen, viewers, we're going to go to our story of the day. I know you're all thanking Dr. Suzanne Humphries for all the work. Thank you for everything you do, Dr. Suze, and we really, really appreciate you. And to our viewers, pray big, stand firm and never settle. And Michael Caine will be with you tomorrow morning. We are live. Tell us your name, please.
My name is Josh Harrison. I'm a PharmD in Johnson City, Tennessee.
And for those that don't know, what does I'm a PharmD mean?
Doctor of pharmacy. So
Okay.
I'm a pharmacist for most people.
All right,
Yeah.
sounds good.
Yeah.
And you make ivermectin.
We do. We sell it over the counter without a prescription in the state of Tennessee. So people can come in, fill out a form, and then we make it and dispense it based on their body weight.
So what exactly is ivermectin?
Ivermectin is actually an anti-parasitic drug. We use it as a deworming medicine for most people. It's what they would recognize it as. But it has a lot of other benefits: anti-inflammatory, antiviral, antibacterial that we've kind of discovered after COVID kicked off, and we were looking for ways to treat COVID.
So here in Tennessee, people could just come and get it. There was never a problem like there have been in all the other states.
I think it was a year and a half ago, the state of Tennessee allowed us to do that. So we worked with Dr. Sibley and the Board of Pharmacy to allow us to do it over the counter with a collaborative practice agreement with Dr. Sibley. So basically, the pharmacy signs an agreement with the doctor, and then we send that to the Board of Pharmacy, and that allows us to do it over the counter without a prescription per se from another doctor.
So have you seen good results from it?
We have. We've seen some, amazing things happen. People that should have probably died or been in the hospital did quite well using ivermectin and over-the-counter supplements during COVID.
So why do you think that the powers that were during the pandemic, why do you think they actively stopped everybody from using ivermectin?
I think one, it's a cheap drug. There's no money in it for a pharmaceutical company, so there's just not money there. I think the other part was they don't want to admit that they were incorrect. Whoever that person may be or that group may be, it's hard to say that you led a lot of people in the wrong direction. So I think it's more just not wanting to admit the mistake or acknowledge that there are other ways to do things.
I think you've hit the nail on the head. No money in it, number one.
No, yeah. It's like supplements, vitamins and supplements. There's not money in it. It's not a $10,000 drug that someone can patent. So even if it works, there's not going to be studies to show that it works.
Okay, how do you make ivermectin?
We purchased powder from, and this is where a lot of people don't really know how we do it. We purchase powder from an FDA approved facility. So we use the same powders that the drug companies use to make ivermectin tablets. So we're not buying it from a Chinese lab or some kind of weird place. They all come from FDA facilities. So we buy pharmaceutical grade ingredients, and then we basically do the math and capsule it. We have capsule machines, and we put it together based on body weight and the math from the capsules.
Because people are saying you should get it compound. You shouldn't just be buying this prescription stuff because it's not as good.
Well, the big thing with what we do is we make it based on your body weight. So if you get the tablets are 3 milligrams. So if you need a 21 milligrams, you'd have to take 7 tablets to get 1 dose. So what we do is we put 22 milligrams in 1 capsule, so you take 1 capsule. You have less pill burden, so you don't have to take a handful of tablets, and we just do it based on body weight.
And we're not giving out medical advice here, but would you say that someone who's starting to feel a bit sort of flu-y should just start taking it, or how do you take ivermectin?
We know it has antiviral properties. We don't know for sure if it treats the flu, but it's not going to hurt you. So the flu and COVID overlap symptomatically. So we don't really know, if you have sniffles or a fever or a cough, it could be either one. So I would say I would take it if it were me, but that's,
Can ivermectin kill you?
I've not seen any reports of death from ivermectin. Early on, there was a lot of discussion about people taking ivermectin and having toxicities and liver failure, liver damage. A couple things with that. They're probably taking something from, like a farm store, and they're using the injectable form or the paste, like the horse paste. Dosing is very tricky when you're trying to dose a 2,000-pound animal versus a 150-pound person. They might have just taken too much, so they may have had some side effects from that. The other thing is with veterinary products, the preservatives are different, and they have a lot more because it's for a larger animal. So if we take, let's say it was aluminum in an injection for a horse, and we apply that to a person, you could have neurologic side effects. So I think all the side effects that people had were probably from either overdosing themselves, or just the type of preservative that was in the veterinary product that was not really good for a human.
Because a lot of people were going to Tractor Supply, buying the apple flavored ivermectin and putting in a juice or whatever.
Yeah, so that's where, if they just squirt a little bit on their finger, that could be 3 grams or 5 grams or 2 grams. We don't really know exactly how much we're getting. And again, the preservatives for animals are totally different, and the amounts they can use. So that, I think that early on, that was a lot of what was happening when they said people had neurologic side effects or they had liver failure or whatever. But with ivermectin, we don't even really dose adjust ivermectin for kidney function or liver function. So it's not going to damage either one of those.
Anything else you want to say about ivermectin?
No, just that it's a good drug, and I think we need to know more about it.
That's right. Now, what about the COVID shots in your pharmacy or whatever it is?
We actually don't give the COVID shots.
Nice.
No, we don't. We never have, and we'll just wait and see what happens with that. So.
You know what you should have in your pharmacy? Some of our Vax Unvax Let the Science Speak books.
Sure. Yeah.
I think we should definitely be donating some for.
We'd love to have them.
Showing people we've got some Vax 2 DVDs. Just hand them on out.
We'd love to have it. Yeah.
What do you think of this bus as you walk around it?
I think I was looking at the signatures and the people that had signed it, and looking at some of the stories, and it's I think it kind of gives people I don't, like something tangible. I can tell my, my story or their story or whatever, but until you put it all together and there's something tangible that people can look at and you see everybody's signature, and it's really profound when you look at just the amount of impact it has.
And in here, this is our memorial, so everyone in here, I mean, a lot of people here would have done well on your ivermectin.
Yeah, and a lot of young people, unfortunately. So
thank you so much for being, first of all, brave enough to sit there and tell us about ivermectin.
Sure.
And for all that you do, because I know you do a lot for a lot of people.
Thank you. Yeah.
History doesn't wait. This is our moment to rise, unite, and reclaim our children's health.
Join us here in Austin, Texas this November at the Children's Health Defense Conference.
In the wake of unprecedented medical overreach and censorship, the world is waking up, and people like you are leading the way.
We're at a turning point in history. With the pandemic behind us, our fight for freedom and health has reached the global stage.
This is our moment of truth, and we're ready to seize it together.
And Children's Health Defense has been at the forefront of this charge. Our 2025 conference brings together the leaders, visionaries, and warriors who made it happen.
Meet the parents whose lives were forever changed, and hear from doctors who risked everything to speak out. Stand with those who refused to be silenced.
You are going to hear from world-renowned speakers, doctors, and frontline leaders driving the medical freedom movement.
Discover real-world solutions grounded in science, integrity, and human rights.
Join the discussion to talk about vaccines, informed consent, parental rights, and so much more.
And you'll, of course, hear from your favorite CHD personalities, sharing the latest on CHD's research, litigation, and outreach.
And while you're there, soak up the energy, culture, and music of beautiful Austin, Texas.
Whether you're a parent, a practitioner, or a medical freedom advocate, this is your call to action to protect what matters most.
Be part of the movement that is rewriting the story for generations to come.
So please join us.
Join us.
Join us. Let's make history together in Austin.